Okay, so let's talk about treatment of mental disorders. So we're going to be focusing on insight therapies, but first let me give you some basic info on the treatments. So there's some common elements. There's the client, which is the patient, and then the therapist. And the client and the therapist have a special relationship in which, the client has to be very trusting of the therapist, and the therapist has to let the client know that they can trust them. There has to be, obviously, legally that, confidentiality, but still, the therapist has to come off as someone that the client can trust. There's also, the therapist comes up with these theories as to the causes of the patient's problems. There are also two types of treatment options. There are inpatient, in which the patient is actually hospitalized, and then there are outpatient. So that means that, the patient is actually going to a therapist's office and having therapy once a week, once a month, however often they have this therapy. So first we're going to talk about the psychodynamic, psychotherapy, and psychoanalysis. These ideas were brought up by Sigmund Freud, and he believed that personality and behavior reflected a person's ego. So that person's personality and the way they behaved was a reflection of their inner ego and the type of person that they truly were. He really wanted to understand the unconscious, and this influenced all forms of psychotherapy. So Freud used a few strategies with psychoanalysis, such as free association, and this is where we get the Freudian couch and sitting on the couch and saying whatever comes to mind to our therapist, and the therapist saying, and how does this make you feel, and what do you think about that? Freud also focused a lot on the manifest and latent content of dreams. So, if you were being chased by a flying monkey and then melted a green wicked witch, this somehow transferred to your relationships in your real life, which doesn't really make that much sense, because I'm not going to compare my mother to a witch or whoever I would be, So this was a different approach that Freud took. He also talked about Freudian slips, which were basically when a person misspoke. They called it a Freudian slip, and that was what the person was really thinking but couldn't say. He also used hypnosis a lot as a way to get his patients to answer questions unaware that they wouldn't normally answer if they were aware. So, moving on to psychodynamic, it is a lot like psychoanalysis, but it is different in a few ways. So, with psychodynamic, there is no belief in the id, the ego, and the superego. It is also briefer and less expensive. If you were a patient of psychoanalysis with Freud, you were his patient for 6-7 years, and it was very expensive, whereas psychodynamic is not like that. It also focused more on helping the client rather than understanding the unconscious mind. And it did a lot with connecting past relationships and comparing them, like tendencies with past relationships, and comparing them to things going on in current relationships to see if there was any connection there. Interpersonal therapy is a type of psychodynamic therapy, but it's very brief. It's only 12 to 16 sessions, and it has been proven very effective with depression. So moving on from that, we have the second type of insight therapy, which is humanistic therapy. And with humanistic therapy, it is believed to be a human encounter between equals. So the client is equal to the therapist. And there's not a cure that the therapist gives. It's up to the client to cure themselves or to improve their situation. They create the conditions to improve. This also brings in Rogers client-centered therapy, which is where you get the very accepting and empathic therapist that will often repeat to you what you said to get an understanding and are very genuine. So that is my project on Insight Therapies. Thank you and have a happy holiday.